Hey folks, Dr. Ohlson here with Sports Medicine Orthopedic Centers. I'm an orthopedic surgeon and I'd like to continue my discussion about shockwave therapy. So one of the most common questions that I get is, does it work? Well, the short answer is yes, it does work. But like most forms of treatment, including surgery, it's dependent upon what you're using it for and also dependent upon the individual. So we spend a lot of time trying to learn what application shockwave therapy is most appropriate for. And I think that's important when you talk to a provider that performs this, is that they have some experience and understanding regarding traditional conservative management, like physical therapy, for example, versus when surgery is needed and all things in between. In particular, shockwave, it is dependent upon what you're using it for. It's probably one of the biggest things we have to consider. So there are some things that it's completely inappropriate for. So for example, if I have an Achilles tendon rupture that happened to an athlete, shockwave therapy is probably not appropriate for that. It needs to be surgically repaired. Converse to that, however, is if we have someone that has an overuse injury involving the Achilles tendon, where they have Achilles tendonitis, then shockwave therapy can be very useful. With that said, I think it's important to understand that this is not an immediate gratification type of treatment. You don't get shockwave therapy and the next day you feel great. This is regenerative medicine, and so there's a bit of delayed gratification. You go through a few treatment sessions. It can range anywhere from 3 to 6. And then once you stimulate the body, you have to give it time for it to heal. So it's a different philosophy as opposed to some of the more traditional forms of treatment like cortisone. So the next thing that we take into consideration when assessing a patient and whether shockwave therapy would be appropriate has to do with the health of the individual. So once again, I think it's important that if you do see a provider for this, that they do take a comprehensive history. That means they have an understanding of your medical history as well as what medications that you're taking. So for example, there are some instances that I think that medications may have an impact on use of shockwave. In particular, individuals that are taking prednisone or immunosuppressants, or they're taking medications for like rheumatoid arthritis. These are medications that sometimes are extremely necessary for certain conditions. However, because we're talking about regenerative medicine and stimulating the body to heal, some of those medications may have an impact on that process. And so there are certain instances where we'll have a discussion that the results of shockwave therapy may be a bit less predictable as far as whether or not we're going to get a win. So I do think it's important, once again, you take the time to discuss with your provider what your problem is, what are the treatment options available, and what your medical history is, medications you're taking, and how that whole package fits together to determine whether it's appropriate. Again, thanks for joining me today. If you have any questions, if you'd like to do a deeper dive, feel free to steer over to our website at smocsc.com. Have a great day.